My name is Rod Murphy. I live in Southbridge. I'm the spokesman for the 10 taxpayer group who will speak 1, 2, 3, 4, 5, and then at the end I will recapitulate. Mr. Chairman, the 105 Code of the Massachusetts Regulations, which is numbered 100.532, established that the Department of Public Health's charter as to the determination of need process. This hearing operates under that charter. The quote from that charter is, "The objective of the determination of need process shall be the allocation of health care resources and the improvement of health care delivery systems such that adequate health care services are made reasonably available to every person within the Commonwealth at the lowest reasonable aggregate cost," unquote. Also, Section 100.552 of the same charter refers to, quote, "the objective of making adequate health care services reasonably available to every person within the Commonwealth," unquote. That's our point. Our 10 taxpayer group firmly believes, based on having conducted some factual research, that Planned Parenthood does not provide such adequate health care, and we will submit 4 supporting arguments and testimony for our opposing case. In fact, in our opinion, widely available information demonstrates that Planned Parenthood is seriously deficient, corrupt, and incompetent in its delivery of services, and that a determination of need finding should be denied Planned Parenthood for the following reasons. Number 1, there have been numerous reports from apparently reliable sources that Planned Parenthood has defied child rape laws in many states with reasonable grounds to believe that more likely than not it has or will so do here in this facility for which it is seeking a determination of need. 2, Planned Parenthood, a billion-dollar company, by its history and actions, has become the largest agent of black genocide in the USA. More African Americans are killed by abortion than any other cause. 3, Planned Parenthood has a terrible and, in our opinion, entirely warranted reputation for unethical and fraudulent business conduct regarding its accounting, billing, medical, and donation practices. And 4, there are credible reports that Planned Parenthood has killed and injured many women by its negligence and medical incompetence, once again providing reasonable grounds to believe that it would do so at the facility for which it is seeking to open in Pleasant Street. After our last speaker, I will respond one more time and give you some testimony. Thank you.
Next is Ms. Santini, please.
I'm not going to read from these documents, but I will be providing information from them. My name is Nina Santinas. I'm a lifelong resident of Worcester. I'm a graduate of this university. I'm also a breast cancer survivor, and I urge every woman in this room to just Google breast cancer and abortion. However, my main testimony is going to relate to what abortion has meant to the African American community in this country. According to the CDC, each year 616,000 African Americans are born. 458,000 babies will have died from abortion. Those are black American babies. 284,000 blacks will have died that same year through anything from natural causes such as heart disease. There are 743,000 African Americans dying yearly. This number is 127,300 more than that are born. And this, most interestingly, from 1973, the year that Roe v. Wade was passed, to 2004, nearly 30% of the black population was erased through abortion. Out of the average 4,000 babies dying daily that are reported by abortion, an estimated 1,300 are African American. They account for 32% of women having abortions yearly, yet make up only 13% of the American population. Further, African American women are 3 times as likely to have an abortion than other women. On this basis, a compelling case can be made that Planned Parenthood of America is involved in the direct genocide of black Americans. This is based on credible news reports and figures from the CDC. The other point that I would like to make, and this might come as a shock to most of you, is that Planned Parenthood has racist undertones in its fundraising practices. A shocking set of recordings was released in March by a student reporter at UCLA which exposed the racism of the nation's largest abortion provider. The reporter contacted Planned Parenthood facilities in 7 states, inquiring if they would be willing to accept a donation earmarked for a black child. The results were jaw-dropping. The reporter was appalled to discover that every last clinic agreed. Not one employee objected, even when the purpose was to lower the number of black people in America. This outrageous transcript can be found on blackgenocide.org and on YouTube, and I urge you to listen to it for yourself. In Idaho, the fundraiser at the Planned Parenthood clinic exclaimed how excited she was to receive money from a donor wanting to reduce the state's black population. The National Black Pro-Life Union has sent a letter to Planned Parenthood headquarters asking why the Idaho fundraiser had not been fired. The letter was signed by several prominent African-American leaders, including Alveda King. The Planned Parenthood, those tapes sent to Planned Parenthood apparently were not offensive enough for the employees to be fired. In Ohio, the clinic worker agreed to accept the donation from the man who said there are definitely way too many black people in this state. And no disciplinary action was taken. Mr. Chairman, Massachusetts should consider this obvious racism, and the Department of Public Health should recognize that racism is utterly inconsistent with the delivery of health care to all of the Commonwealth citizens, and the requested determination of need should be denied. Thank you.
My name is Linda McManus, and I live in West Boylston. I thank you for the opportunity to share this important information with you tonight. Credible news media sources have reported that Planned Parenthood has been involved in fraud against taxpayers, insurance companies, and patients. A news report earlier this year from the Los Angeles Times by Charles Ornstein, March 8, 2008, involved the Vice President of Finance for the LA Planned Parenthood, Victor Gonzalez. He has filed a whistleblower suit in federal court claiming that Planned Parenthood committed fraudulent overbilling against government-funded programs. Gonzalez submitted documents spanning the late 1990s to 2004, including a series of audits which suggest that the nation's biggest abortion merchant may have swindled upward of $180 million from California taxpayers. Gonzalez said he was fired in 2004 after repeated attempts to address the illegal accounting, billing, and donation practices of Planned Parenthood with his supervisors. According to Gonzalez's attorney, Planned Parenthood manipulated its charitable organization status in order to buy contraceptives at a discounted rate, then billed the state's Medi-Cal program for 12 times what was paid by Planned Parenthood. The Los Angeles Times also obtained copies of the 2004 audit, which substantiates over $5.2 million in overbillings at the San Diego branch during the fiscal year 2003 alone. In total, the overcharging is said to exceed $10 million a year. According to WorldNet Daily, October 31st, 2007, another lawsuit was brought by RN Nicole Chessis against Chicago's Planned Parenthood and its medical director, Darren Dunbar. Dunbar fired Chessis on April 10, 2007. Her lawsuit lists the following allegations. Planned Parenthood changed the dates on ultrasounds so that patients would have to pay a higher price for abortion services. They failed to ensure the presence of an anesthesiologist, a registered nurse, or a licensed physician in or around the recovery room when sedated patients were present. Unlicensed employees with no medical training were performing improper ultrasounds and were making ultrasound diagnoses, and prescribing Depo-Provera to a patient with a history of depression. The Planned Parenthood corporate culture seems to have engendered and permitted such practices and has certainly failed to prevent them, all leading to an obvious lack of adequate, reasonably efficient health care. This dismal record should be enough to disqualify any determination of need for Planned Parenthood in the present proceedings. Thank you.